This video illustrates the first stage of the transformation that this boy had after 6 months of ABR program. What we are seeing straight away, right after these 6 months, we can already see significant changes. First of all, in the domain of segmentation. Let's have a quick look at what we've seen before. That's how he looked just 6 months before. The characteristic W shape position of the arms, very rigid, very fused and fixed. Placement of the head being really uncomfortable. I beg your pardon for this grainy image, but it's taken from the video. And what we are seeing today, we are seeing the improvement of these first elements. Segmentation, that first domain that we just talked about. The arms are placed comfortably behind his head. You can see that the room for the neck movement has clearly improved comparing to what we have seen before. Just pay attention to this area of the stiff neck. And we can move further and see the next components. See, the next component is obviously this, the improvement of the mobility of the arm in respect to the body in the position on the stomach, prone position. Well, let's get a quick look at what we have seen before. That's what we started from, right? Complete stiffness, complete rigidity. So you can see even when he is unhappy, we can still observe the room for the arm movement. That's a very important initial transformation. And as we already talked about before, if the step 1 is the development of the segmentation, then step 2 is weight bearing improvement. This is that second component. This is what we describe as the ground reaction related weight bearing component, right? Ground reaction, it's easy to understand, transfer of loads onto the ground. And again, it's very clear that his overall stability in this position has improved quite dramatically comparing to what we've seen before when he was stuck and unable to move. And respectively, as we move on, we can see this emerging room for the movement of the head, and voila, here we go. With the improvement of the first component, second component, we now can see the third one, the actual hand function, improving. For the first time, he was able to start using the bottle, so he's able to have enough freedom of the hand movement in order to get a grab of the bottle and keep it at the midline and then coordinate it with the movement of the head forwards. So that's why I'm bringing you back to this video, where you can see how his head gained this really important starting movement forward that allowed him to get this coordination, because previously his head was profoundly tilted backwards. And continuing the movement of the hands discussion, we can see that his range of movement has improved significantly. Although at this video we can still see that his left arm, the more restricted arm, has a lot lesser range of movement than the right one. And this is the component that we have to keep in mind, and we'll keep observing the transformations later on. Again, the focus that we are having here is to keep the attention on the fundamentals. I repeat that both arms were affected in the uniform pattern of being shifted above the normal shoulder line, of being way too high in respect to the neck and to the base of the skull and in respect of the depression into the back. That's why when we talk about the progress of the hand function, again, we separate two components, two levels within it. Well, first, we talk about the entire shoulder girdle as a circumference, as a unit, regardless of what's the difference between the arms. Because in a quadriplegic child, you don't have really the situation where it's truly just one arm being deficient. And the second thing, only the second level, is the actual subdivision, the performance of the individual arms within the shoulder girdle as the uniform circumference. That's very important because typically, again, the classic strategy would be about isolating the weak hand and the more stiff hand and trying to apply some forceful applications to it. We don't chase those individual targets as the primary thing. We look at the things which are common. We look at the commonalities. We look at the joint or like mutual foundation of the weakness. Because again, in this case, it's not only the left arm which is affected. This overlap of the entire shoulder girdle and the depression of the shoulder blades was present on both sides at once. So that's a very important thing to understand about the overall ABR strategy and the sequence of transformations. So we're seeing his happy moves. Again, keep your attention on the much lesser range of movement on the left side. And again, at this half a year mark, we were able to see him starting to do the initial mobility on the floor. We discussed this in detail at the chapter dedicated to the crawling. But here we can make just few remarks that anyway, his weight bearing started to improve comparing to what we've seen before when he was completely stuck. But again, we're seeing that the left arm is relatively behind it, but that's not the key focus for us. We are focused, we are paying the main attention to this component, to the entire shoulder girdle as a circumference in respect to the entire circumference of the head, neck, and the rest of the trunk. So that's the key idea to keep in mind as well. So two big ideas, right? First idea, segmentation as a starting base, weight bearing as the first most important functional conversion, and only afterwards looking for the free hand motion. And within the analysis of the hand function, whether it's weight bearing or whether it's the hand motion or free hand function, we are looking at the circumference first. And only then within the circumference, looking at those selective inverted cones of support for each of the arm alone. Now, another important nuance that I want to clarify here, that we should not allow ourselves to get fooled by certain elements. You see, for instance, here, what we are seeing. For this boy, his lumbar spine mobility has improved. His space between the base of the skull and the shoulder girdle has improved. But we are still seeing that his elbow is not really touching the ground completely. And we shouldn't get fooled by the fact that his head is being lifted so high. If we zoom in, we're going to see that here lies the limitation. This high elevation of the head comes to a great extent as the being supported by remained stiffness of the superior muscles of the shoulder girdle. We don't want to see that. We want to see the true release, the true descent of the shoulder blades. So therefore, in that respect, even if it's kind of currently functionally usable, it's not something that we're going to hold on to. We want to see the true fundamentals, not the fake height of coming up, but we want to see the true transfer of the weight through the elbow and onto the entire cone, inverted cone of support, and through the entire circumference of the shoulder girdle. And of course, here we can still see that he's not able to use the arms fully for that weight bearing. But as a transitional conclusion, it's quite obvious. The hand function has improved quite considerably following the strengthening, and the strengthening that brought the release and the improvement of the segmentation. Well, with this, let's move on to the next phase another half a year later.